Following tooth preparation, gingival retraction is done using magic foam cord. What is the chemical nature of this material? Okay, so here we have a commercially available gingival retraction paste, and we have to answer the chemical nature of this material. Giving you a brief heads up about gingival retraction. Gingival retraction is nothing but deflection of the gingiva away from the tooth before making an impression, so that you can record the margins more accurately, and the visibility is also better, especially for subgingivally placed margins. So gingival retraction can be done either mechanically, like copper bands or cords, or chemically, for example any astringent, epinephrine or aluminum chloride or acidic salts, or a combination of both. So you can have a chemico-mechanical method also. So you can have these impregnated cords which are used for gingival retraction. Now the recent advancements in gingival retraction include this gingival retraction paste. Gingival retraction paste. These pastes are commercially available. They are very easy to use and very efficient. So you inject the paste around the tooth as shown in this image, and then the paste will contain chemicals suitable for retraction. So they can have a vasoconstrictor, they can have an astringent, or etc. depending on the nature of that material. So one of the very common or popularly used material is magic foam cord, which is a chairside material, very easy to use. Now we have to answer what is the chemical nature. Is it polyurethane, carboxylate, polyvinyl siloxane, or polyacetate? Now if you try to remember the different materials used in temporization, you will realize that polyurethane, carboxylate and polyacetate are nothing but crown and bridge restorative materials. Okay, they are acryl based or composite like materials that can be used in temporary restorations, in provisional restorations. So they are very thick and are more of restorative value. Polyvinyl siloxane, on the other hand, you may have come across this word in impression materials. Now if you look at the material carefully, this looks like light body addition silicon, that is polyvinyl siloxane, and that is the answer to this question. So on similar grounds, there is another material known as Expasil, which is also very popular. Okay, Expasil is a clay-like material. It contains 15% aluminum chloride. So you should remember this as well, because that is another material which is popular. Here let's have a look at how this material is used. So there is a cartridge and there is a tip and there is a gun. So auto mixed and injected around a prepared tooth. So this is a prepared tooth on which there is material which is injected. There is absolutely no bleeding involved, because you are not packing the cord around the sulcus. So that whole process is eliminated. This is also a chemico-mechanical process. Then expand, here you use a roll with this material, and the patient is allowed to close on this material under pressure for 5 minutes, and with the help of that tissue displacement is achieved and you can record the impression. So this is all you need to know about magic foam, which is a polyvinyl siloxane material.